Good morning. I'm Dr. Gill, and I'd like to talk to you for a little while about osteopathy. I don't know how many of you know what osteopathy is, but my goal here is to ignite your understanding of the power and the impact of osteopathy for you and your family. And my colleagues and I have practices made up of patients who've been everywhere. In our experience, osteopathy can help with most problems. I know how that sounds, but let me do a little bit to explain why. Let's talk about epidemics, because that's what we're in the midst of. In 1918, there was a flu epidemic, and that actually put osteopathy on the map. Evidence showed that patients who received traditional osteopathic treatment had a much higher survival rate than those treated by typical medical practices. The influenza mortality rate for patients receiving osteopathic treatment was 0.2% compared to the national mortality rate of 10 to 12%. And for those patients who went on to develop pneumonia, there was also a much better survival rate. So I hope I've captured your interest to continue. Let's give you some background and explain some more. This is Dr. Andrew Taylor Still. He was a remarkable and very poetic physician. He said that to find the health should be the object of the doctor. Anyone can find disease. After the agony of losing his wife and his children to meningitis, despite the current best medical practices, Dr. Still created osteopathy in April of 1855. He developed a virtuoso intellectual palpatory knowledge of human anatomy. Then he put his hands on sick patients and healthy people, and he asked himself over and over again, what's the difference? What can I deduce about how how the body succumbs to disease or how it heals itself? Carefully, he began to find clues about the texture, the position, temperature of disease versus healthy tissue. And he created many types of manipulation to facilitate more healthy patterns all over the body until the patient's healing system could take over and get better. We are all constantly creating new ways to osteopathically treat our patients, combining our training, experience, and research. So osteopathic physicians go to 4 years of medical school, osteopathic medical school, and they have 3 to 5 years postgraduate training. They can be pediatricians like Dr. Kathryn. They can be ER doctors, or they can really focus on what I focus on, which is manual medicine, even though I'm an MD. Osteopathic care and treatment requires a licensed physician with extensive knowledge of structure and function and years of training in traditional osteopathic manual medicine. This is the most comprehensive and inclusive medical system in the world. It integrates biomechanical manual medicine with Western and quantum medicine. So in this talk for you, I'm going to explain what osteopathy is, a little bit about how it works and who it can help. You can see some possible issues that we treat in the colored diagram on the slide, showing you that we treat carpal tunnel, we work with asthma, menstrual issues. And I'm also going to show you some photographs of patients before and after they've had treatment so you can get an idea. I'm recognizing that the audience is both lay people and health professionals, and so we're trying to provide to you a variety of information so it makes sense to each one of you. Osteopathy is not just the study and treatment of bones. Osteo actually means structured living tissue. So we study and treat every tissue in the body. Osteopathic treatment works to support a reciprocal balance in all of these living tissues. The osteopathic philosophy is that prevention and treatment of the whole body are keys to healthy living. And you can see in the cartoon that we work with the bones, the organs, the muscles, everything. So the structure or the anatomy of the human body affects its function. Kind of makes sense, right? And you can see there's a variety of structures here: connective tissue, fascia, your lymphatics, your skin. Just because you have all those structures doesn't mean that they're in the best position or the best relationship with one another. Much like an out of tune instrument, when our bodies have suffered from birth challenges, trauma, surgeries, it can affect every part, every system, and we do not function optimally. The science of osteopathy is based on evaluating what's the current compensatory pattern in this whole patient, and then we design an effective manual treatment just for you. So what are some of the ways that it works? Osteopathy unfolds us in a certain sense, especially with newborns. It removes obstructions on a biochemical, cellular, and whole body level. Osteopathy can treat something today that occurred days and months, even years ago, and help the child or adult to release it. Osteopathic scientific principles synchronize with our own body's therapeutic forces by utilizing the physics and the chemistry of healing found in our own bodies. So let's take an example of a car accident. This man's sitting in his car, and let's imagine that he's hit on the driver's side, the left side of the car. His whole body will be flung to the right of the car, but his left shoulder and right hip are a bit more restrained because of the seatbelt than the rest of his body. That means that not only the bones and spine are pushed to the right, and you might have a sideways whiplash or back pain, but also that the soft tissues could be affected. And this is something that's not really addressed anywhere else besides the osteopathic profession. So the heart, the lungs, even the esophagus might be slightly dislodged to the right of their normal position due to this high velocity, high force impact. And this may have an effect on the function of all these organs. Osteopathy is engineering for the human body. We combine the information from your medical history, your physical examination, and a careful osteopathic examination to find potential causes of disease and dysfunction. Our tools are our hands, which can change bone position, breathing, muscle tension, even movement of cerebrospinal fluid in your brain. At the moment of conception, the potential for everything we could be is right there. In life, we're always a fraction of our total selves. Osteopathy is steeped in the understanding that mind, body, and spirit work together to create an adaptive compensation. This compensation is like a sewing needle, which ties together seemingly unrelated parts. The compensation or fulcrum allows life to continue in the face of injury or disease in order to keep us alive, but that compensation may not be our full healthy function. So that adaptive fulcrum or compensation is actually the best effort we can create by using our own resources, and we hold on to it with our physical and mental being for survival. So the osteopath's work is really to find and interact with this organizational fulcrum in such a way that the individual, the patient, can be free enough to move towards fulfilling the promise of their potential. This has a very different meaning for a patient who sprained their ankle than an infant whose mouth won't suck correctly and they can't nurse. So how does osteopathy work? Well, one of the famous quotes in osteopathy is that we need to develop seeing, feeling, and thinking hands. The osteopathically educated physicians use their highly trained visual and palpatory skills to deduce factors which are causing dysfunction. We understand that gentle, small changes in the building blocks of your structure can affect your well-being. There's no scientific instrument that's been created that's more sensitive and facile than the human hand. We can actually feel a difference as small as 75 angstroms. That's less than the width of a human hair. With the unique medical training that osteopathically trained doctors receive, we can evaluate the health and disease of tissue. Our hands can feel subtle temperature differences, changing blood flow, fluctuation in the tension on ligaments, and we become skilled at interpreting those palpatory findings into a complex understanding of your dysfunctions and how to work with them. So just for a brief example, recently I had a patient come to the office with long-standing gastrointestinal issues and a chronic cough. He'd seen multiple internists and gastrointestinal specialists and had been diagnosed with reflux. After listening to his story and doing a careful physical exam, I placed my hands on his chest wall and evaluated his lung tissue. My osteopathic palpation told me that he had pockets of pus in his lung structure, and I diagnosed him with a different issue. I diagnosed him with bronchiectasis. I told him he would need a pulmonary CAT scan and that he should see a lung specialist, who later confirmed, yes, indeed, he had bronchiectasis. And we've begun trying to help his body heal this infection. What I want you to understand here is that this is a tool for the osteopath. It's a tool for diagnosis, and it's a tool for treatment. So because I'm an MD, I have a foot in each camp, and I can do a little quick comparison for you. In medicine, we often deal with one variable at a time. You have an infection, we give you an antibiotic to kill the bug. The osteopathic treatment and evaluation looks at multiple interacting forces at once, organ systems, your habits and traumas, and we use the medical tools. There's also a time delay in medicine because we're waiting for the lab tests or the imaging studies. But the wonderful advantage about osteopathic training is we can have immediate functional and anatomical information regarding the extent of the problem and the interference that it has with the overall health of the child or the adult. Medicine frequently asks, what's the disease, and has a protocol to treat it. Osteopathy asks, how can I support you today to reach towards your body's potential for self-regulation and repair? So remember that epidemic we talked about in the beginning of the talk? For the immune system to fight infection, it has to find the infection. And one of the great things we can do osteopathically is to maximize blood flow to and from the infected areas. We can increase freedom for diaphragmatic motion. We can do a number of things. And research in osteopathy has shown that it's possible to significantly increase circulation, mobilize white blood cells, increase oxygen exchange, etc. Moreover, the treatment is actually modified moment to moment until the physician perceives a physiologic or functional response in you. As we work, we feel these changes happen, and then we can move our attention to a different direction of physical support for you, or we might move to treat another part of your body. How do we know something has changed? With our eyes, with our hands. And as a layperson, you might observe relaxation on the face of the person being treated, or that they get pinker because their circulation is improving. So now I'm switching gears to another aspect of osteopathy, cranial osteopathy. This is a child with plagiocephaly, or flattening of the skull. Actually, there's 22 bones making up the skull and face. And in an infant, those bones are in developmental pieces, so there's more pieces to work with. More importantly, the distortion that you see in the face of this lovely baby and the top of their head and the top of the slide is really not just in the head. It's actually part of a pattern that affects the entire skeletal system. So unlike using a helmet, osteopathy works with the whole system to improve function as well as cranial form. These are a couple of my patients. I'd like you to look at the slides, the pictures on the top. One way we treat infection is to improve lung expansion and rib and chest wall motion, diaphragm function. These photographs were taken about 40 minutes apart. So the picture on your left will be of the before the treatment, and you see the baby with the blue arrows. They're pointing to the partially deflated right chest wall and lung and the right tight diaphragm. And after the treatment, you see on the right-hand side, this infant can fully expand their chest the nipples are farther apart, and they can move their diaphragm. You may notice that the whole body appears more relaxed. I think this is miraculous. I hope it gives you something to think about. And the photo below, you can see that this child's having a great deal of trouble expanding his lungs. I put a little skinny black arrow right where his diaphragm is. And you can see after the treatment how much better he is, even in 30 minutes, at expanding his chest wall. If the lungs can pull in more air, there is faster and more complete oxygenation of red blood cells, carrying oxygen to our 75 trillion cells in our body. No single part of the body lives in isolation. Every system, every bone, every cell is in communication with the whole organism in health. When we have been disrupted by injury, infection, surgery, emotional or mental stressors, the reparative systems can start to fail. So, what can we help with? This is another list of some of the things that we can help with. All of us work with many, many different issues in our patients. The wonderful thing about osteopathy is whether it's swallowing dysfunction, cerebral palsy, pain, constipation, bedwetting, osteopathy is a supportive system. We can help children to make changes so they are more receptive to physical therapy, orthodontia, even psychotherapy. What do I mean by this? I'm going to show you a few more slides, and I hope that that will collect your understanding of how we do this. The next slide is a patient who has had physical trauma, and I want you to just, get yourself ready. This is a lady with some bruises on her face, but I'd love for you to see the changes. So this lovely client of mine gave me permission to show her Odyssey of Healing. Please don't take pictures of any of the pictures of my patients if you're watching this. She fell on her face in mid-December and fractured the right side of her nose. You can see how swollen it is on the right-hand side. And I want you to understand that very specific, careful support was given to her so her healing forces could resolve the injury. Can you see that her face has changed from December 15th, 2020 to February 23rd, 21. Can you see that the right side of her nose has become much more normal in shape? Even her nostril, her right nostril became more normal in shape. That was after the visit on the 30th of December, where she was seen at 9:22. She couldn't breathe through her nose, and at 9:21 she could, which was very exciting for her and me. There's no drug or surgery that does this. As a matter of fact, embryologically, all cells are developmentally designed to respond to the language of force. Force, like compression, is the way that we get cells to form bone. So when we have an injury, a bone interprets that impact and adapts to it. Osteopathy actually works with these forces and compensations to help resolve and heal the injury on every tissue level. So these are some of the different types of osteopathy. I practice a lot of biodynamic osteopathy and osteopathy in the cranial field. And you see at the bottom, there's something called high velocity, low amplitude. That's like crunching. The osteopathic profession is designed to continually upgrade and incorporate new scientific information so we can create new types of treatments. And as we evolve in our understanding, like every field, we have more skill at what we can do for the whole patient. So there's a lot of different types of treatment, as I just showed you some of them. All of these treatment types exist on a continuum from non-force, like biodynamics, to force, like HVLA. So what are the objectives of treatment? We're trying to organize and present parts of the patient's system which are not coherent to the healthier part of the body. So if the osteopath diagnoses that we need to use more force, our perception might be that there's a fulcrum organizing the patient's problem, and it's in a small local area like a vertebrae. So the treatment might be that HVLA or crunching thrust. This allows the doctor to move the vertebrae, but it's done at the expense of being able to perceive how the vertebrae needs to be integrated in the whole patient. If our diagnosis leads to a broad many-system pattern of compensation, we might work more biodynamically, which allows the totality of the patient to shift, but might not change the local vertebra. We have to go back to that later. In my practice for the first few visits, I always approach every patient as if they were a newborn, even if they're 70, and treat with those principles of biodynamics, which is a quantum type of medicine. So physical health is really affected by the body's ability to communicate. And there are many complex feedback systems. The heart actually does much more than pump blood. It actually sends out photons of light and specific sounds in a language to all the cells. And the osteopaths are trained to carefully evaluate this blood flow and get it moving better to tissues that need it so that we can help with concentration or memory, etc. In cranial osteopathy, we can work with everything inside of the skull, and we can apply those principles to everything outside of the skull, those principles and techniques. So for the healthcare providers, we can interact with the limbic system, the psychoneuroendocrino-immunological interactions, all of which are modified by mechanical restrictions in the container, the skull and its subparts. And we can treat the cerebrospinal fluid flow and blood flow and the lymphatics. I work with a young man with hydrocephalus who has tremendous difficulty detoxifying. He has a shunt to move the CSF, and he'll shut down and become angry when he's exposed to typical things in the environment and chemical substances, but he responds very well to cranial osteopathy. So what is health? Health is the freedom to shift. And we need to be able to shift our temperature, our emotional state, our physical position. Osteopathy works on every level to support that primary idea of freedom to shift. When a child has had a number of falls and hit their head and suffered through stressful moments, it gets to be too much. And many parents notice that when they bring their children in for osteopathic treatment, not only do they feel happier and sleep better, but they're more able to deal with the stresses of life in their world. So what are some reasons this might be happening? Well, if our sensory nerves don't tell us correct information about our physical surroundings, where we are within the physical surrounding, we can't form complex evaluations, we can't integrate what's happening, and we can't perform operations or actions normally. And this leads to problems, compensatory habits, psychologically, behaviorally, and physically. I'm going to show you a little boy in my practice, and here he is walking. And just watch his hands and his legs. Osteopathy can help with integration. And I'm asking him to let go of his pockets, and it's hard for him. He gets off balance and he's not sure where he is in space here. And he's going to stop, and I'm going to ask him to balance on one leg and watch the tremendous difficulty he has with this. And now he's going to try and balance on the other leg. And then I'm asking him to not hop, and he smartly leans against the wall to help himself not hop. So let's go to the follow-up visit. This is about 35 minutes later. There we go. Okay, so you're going to have to kind of watch two of them at once. I'm using two monitors. So if you see him walking back and forth, he's kind of proud of himself here after his treatment. And here he comes again, trying to get him not to pull up his pants. And in a second, I'm kind of running out of time here. We're going to see him stop. Look how close his feet are together. Now watch him stand. So that's actually a really big change. So often we'll ask children to draw pictures of themselves or their family in order to see how they experience themselves. And you can see this child in the blue arrow feels very tiny with his family. There are very important osteopathic approaches to family, which help us heal and move through the family system. I've used this to support therapists treating children with grief, adoption, death, moving away. And by helping them have greater function in their nervous system and reducing fight or flight, they can be more receptive to therapy and cognitive treatment. The last picture that I really want you to see is this 5.5-year-old boy in my practice. And on November 19th, 2018, I asked him to draw a self-portrait, and that's kind of the scribble that you see on the left-hand side of the screen. I asked him, where's your head in this picture? He couldn't tell me. So we did a biodynamic treatment for him. And 5 weeks later, he came back in and I asked for another self-portrait. And you can see now he has a head and some eyes, not a mouth yet, and no awareness of his arms. But the next treatment, I really did try and address helping him to find his arms and more of himself. And at the end, 6 weeks later, he drew us a smiling, happy self-portrait with arms. So I'm hoping that this is giving you a little bit of an idea of what we do with osteopathy, and it's given you something to think about for today.